All right, let's finish up chapter 21, finishing up required benefits and then going to discretionary benefits. So there are a lot of state mandated benefits. Kansas doesn't provide or mandate a lot of benefits, but there are other states like California that do. So things like temporary disability insurance, paid family leave, and state health insurance mandates that go above and beyond the federal mandates. So if you're going to be working in HR, you need to know not only the state that you're in, the mandates that might be the laws that might be required for the benefits that you provide. But if you have employees in other states, and this is where employees were moving during the pandemic that caused a lot of problems for workplaces, there are going to be laws that you have to follow for those employees because it's based on where they're at, not necessarily where your home office is at, that you're going to have to follow as well. So when employees were not always telling their employers they had moved, this can be a problem, a liability for the employer. And so you need to know where all of your employees are at and then make sure that you're following the state laws around compensation, but particularly benefits for those employees. So employers have to track multi-state requirements. That's why the Society for Human Resource Management, SHRM, can be really helpful for HR professionals because they have access to information for different state laws. And they can also help you make sure that you are following where all of your employees are at to make sure you're following the laws in all those places. It does create compliance complexity, though, for employers when they have lots of employees in different states or if they have offices in lots of different states as well. And then I just wanted to mention the Affordable Care Act changed a lot of laws around healthcare. The ACA, or this is also known as Obamacare. So if you hear people talking about Obamacare, it's the same as the Affordable Care Act. This was a law that was passed by Obama, and it set out a lot of guidelines that didn't exist before around healthcare. Um, the ACA is applicable to large employers. These are people who have 50 or more employees, full-time employees. If you have that, that means that you have to follow the ACA in terms of health insurance. That means that large employers have to offer affordable minimum value health coverage. Minimum value health coverage can be things like you have to be able to have healthcare plans that pay for annual physicals, for example, and employees don't pay for those physicals. There's lots of little rules like that, so you'd have to follow that if you're a large organization. And then if you don't provide that kind of healthcare coverage, there's what we call play or pay penalties for non-compliance. So if you don't provide healthcare coverage or if it doesn't meet those standards, you actually have to pay a fine to the government for not providing that as a large employer. Smaller employers who don't have 50 full-time employees do not have to follow these laws. Often, what smaller employers do is instead of providing insurance, they may provide a subsidy to their employees, and their employees go and buy their health insurance on a health insurance market. There's a 90-day maximum waiting period for health insurance if you're a large employer, and there's dependent coverage up to age 26 for health insurance plans. That did not exist when I was in my 20s because I was in my 20s before this was passed. So if you were younger and you were in your first job, you're reliant on that job to get your health insurance. Now you can stay on your parents' coverage, which can be freeing for a lot of younger people who don't have to worry about health insurance for picking a job. They can potentially go into careers where the health insurance isn't great when they first start their careers to really maximize building the skills and the knowledge and experience they need to get better jobs later in their careers. So beyond ACA requirements, health insurance is discretionary. So the ACA requirements are for large employers. You have to provide health insurance. For all other employers and for other kinds of plans, health insurance is discretionary. This is the most common discretionary benefit that employers provide. There are lots of different plan types. Our book talks about HMOs, PPOs, and high um, uh, uh, HDHPs, where you're paying a high deductible plan. There are also lots of coverage levels. There can be employee-only plans. A lot of larger employers can have family plans where you can include dependents on your plan. There's lots of cost sharing, as I mentioned before, premiums, deductibles, and copays. And then there's going to be network breadth and provider access, meaning you might have lots of different, you might have a provider that has lots of different services available. They might have access to lots of different kinds of doctors and specialists. But the more access they have, that may or may not reduce the price of the healthcare plans you provide your employees. And then Supplemental to health insurance, usually dental and vision and prescription plans are separate from health insurance plans. So if employees choose these plans, a lot of times employers make employees pay for those plans themselves. Whereas with health insurance, employers often pay some proportion of those plans and the employees pay the rest. Retirement plans are also discretionary. Again, if an employer provides a retirement plan, ERISA is the law that would tell them like what is mandated as part of that plan and how do you ensure that that plan will be solvent when people go to retire. In the past, people had defined benefit plans where the employer promised a specific amount of income during retirement. But again, a lot of those became insolvent. Because either employers didn't invest the money very well, so they couldn't actually guarantee the amount that they said they would when people retired, or sometimes companies went completely bankrupt, and so they didn't have any money in their retirement plan. And so these are increasingly rare due to cost and risks. A lot of times they're only in like some federal employees have these kinds of plans, and industries where unions are really strong sometimes still have defined benefit plans. These are also called pensions a lot of times. Pension formulas were based on salary and tenure. So, how much was your salary, usually in the last few years before you retired, and then how long did you work for that employer? Most of you, including myself, will have defined contribution plans where employees put in so much money and you know exactly how much money you're going to put in per month. And then sometimes employers match to some extent the amount of money that employees are putting into that plan. You can have 401ks, which are the plans that people who are in private businesses have. A 403b is what I've always had working at a university. And then 457 plans are for state workers. These are all the same kind of plan. They have slightly different rules, but they're really just different because of the different kinds of industries or organizations that people work for. Employer match investing schedules can vary, and these can be ways to save money if the retirement plan costs a lot or if you need to control expenses on your benefits. But with defined contribution, the investment risk now shifts to the employee instead of the employer, which the defined benefit plan put that risk on the employer. So employees risk their own money, and then they have to make their own investment decisions to make sure that they can pay for their retirement. Another discretionary benefit that most employers provide is paid time off. These include vacation and personal days. Often, and I've had this in many jobs I've been in, you often only accrue a certain amount. Like I would only accrue 1 day per month. The longer you're in an organization or the higher up you are, you often can accrue more than 1 day per month. And then sometimes there's a waiting period to use vacation or personal days. So my first job, I couldn't take, I was accruing vacation, but I couldn't take it until I had been in the job for 6 months. A lot of places also provide sick leave, and then some states and cities now mandate sick leave. For example, for those of you who live in Kansas City, you may have seen that Missouri passed a law that was supposed to mandate sick leave, and now the legislature is trying to take back that law. That would be one of the states or cities that's trying to mandate sick leave. Again, holidays are employer's choice. Federal workers tend to have more holidays off, but many employers will recognize at least some holidays a year where they pay their employees to have the day off. You can also have paid time off for bereavement, jury duty, or military leave, and that can vary by employer. With military leave, there are some laws around what you have to provide for military leave, but otherwise, a lot of this is employer choice. And then the trend now is for employers to just have paid time off without separating it into these categories. So when I first started working about 20 years ago, you would have vacation time and then sick leave. And now most places just have PTO and you choose how you want to take that PTO. This saves on administrative costs because HR only has to follow how many days per year people have available in their PTO bank. They don't have to, or their PTO account. They don't have to figure out vacation versus sick leave days. And it also can be more flexible for employees to choose how they want to use that time. The one drawback, the biggest drawback is that a lot of people would rather use that time for vacation than sick leave. So sometimes employees will work when they're sick when they really shouldn't be, or they'll even come into the office and potentially make lots of other people sick because they don't want to have to take PTO and they want to save it for a vacation later. Life and disability insurance is also a discretionary benefit that a lot of employers, especially larger employers, provide. You can have group term life insurance. This is often one or two times the salary of the employee, and employers will pay this to cover the expenses should something happen while the employee works there, and their family needs to pay like funeral costs. They need to pay other expenses like bills or mortgages that the employee was paying before. Employees often also have supplemental or voluntary life insurance they can pay for. And again, these are cheaper plans than employees could get if they went by themselves to an insurance agent and tried to get their plan. So that's why a lot of employers, especially larger employers, will provide these plans because they can be cheaper for an employee to buy with the huge group discount that they can get. With disability, we have short-term and long-term disability. Short-term disability is an income replacement for non-work injuries, and short-term is just like a few weeks or months. It's typically about 60 to 70% of your pay. So if you've ever seen commercials like Aflac, that is short-term disability usually. I think they also provide a long-term disability plan. And this can provide coverage after the short-term disability plan has been exhausted. So this is for longer term unemployment. And again, it helps pay for the lost wages that you have because you've been injured, and they're not necessarily work related. So you're not getting workers' compensation for that injury. These are discretionary unless the state mandates it. Kansas doesn't mandate this kind of insurance, but other states do, as I mentioned before. You can also have employee services and perks that you can provide, things like assistance programs. These are programs usually provided by third-party providers that can provide assistance when employees have questions about what's going on in their life. They need some help to find providers. They might need some counseling. They need referrals to professionals. If you're getting divorced, for example, and you need to find a lawyer, an EAP could help you find that lawyer. A lot of larger employers provide these. Many smaller employers are starting to provide these more because the third party providers can provide lots of different services and the cost isn't that much for employers a lot of times. You can have tuition assistance or student loan repayment programs. This can be very attractive for younger employees, especially younger employees who might want to go back to school, might want to get a certification, or in some industries where you have people who have a lot of student loans, like in law or teaching, where people want to be able to pay off those loans much faster. Some places can provide care or elder care support where they either have child care on premises or they provide some kind of stipend to go find child care. They may also provide services for elder care or give some flex time to employees to deal with child care and elder care issues. A lot of employers, especially larger employers, can provide wellness programs like paying for gym membership or having biometric screenings to help prevent health insurance costs in the future. Transportation and parking can be paid for. There could be employee discounts for certain kinds of vendors that work with that employer. You can also have remote work stipends that help people pay for equipment they might need in their home. For example, a computer or having a good desk set up for them to be able to work at home.